Tonight, there's growing concerns about the coronavirus, with 2 confirmed cases in the U.S. and now a possible case in North Carolina. Health officials say in the coming days, more people will be diagnosed as it spreads around the world. At least 41 people have died in China, more than a dozen of them in Wuhan, where the outbreak began. The U.S. again with 2 confirmed cases, one in Seattle earlier this week, the other today in Chicago. And doctors are actually looking into 63 possible cases across 22 states, including now 1 possible into Raleigh-Durham Airport. Now, earlier tonight, reporter Aaron Edwards learned the possible case involves a person who flew into Raleigh-Durham Airport yesterday.
The patient flew from China to JFK, where the CDC is conducting screenings for coronavirus. Then from JFK to Raleigh-Durham Airport. Now they're in isolation at Duke University Hospital.
I just think it's lucky that it didn't come to Charlotte. I mean, Raleigh is a big city, but if it hits Charlotte, Charlotte's a central hub.
The passenger had traveled to China and passed through Wuhan City, where the coronavirus outbreak originated. But that person did not visit the seafood and animal market linked to many early cases.
It started from an animal source, but now has changed so that it has the ability to spread from person to person within, especially when there's close contact between people.
Airlines are now taking precautions. American Airlines, the main carrier at Charlotte Douglas, is expanding travel waivers to people headed to China. We're told some crews flying into places like Shanghai, Beijing, and Hong Kong will now be allowed to wear face masks.
It seems like everything is very contained and feels like everyone is taking the proper precautions.
Coronavirus is a respiratory illness. Symptoms include fever, cough, and shortness of breath. Right now, the CDC believes symptoms can show up as few as 2 days and as many as 14 days after someone is exposed.
This is in the same family of viruses that cause SARS and MERS.
Infectious disease specialists are reminding us if you have not been to China, you are not likely to get this virus.
So did you travel to China or one of the areas that are seeing more sustained transmission? Are you a contact of someone that's known to have this infection? Those are the people that are really highest risk right now, not, general public here in Charlotte, North Carolina.
Aaron Edwards, Channel 9 Eyewitness News.
Now, one of the doctors at Duke University explained the process the team is taking with that person who has the possible case of coronavirus.
Yesterday we knew that a patient had arrived here who was recently, as you say, from China. So we've executed our standard protocol for such a patient, which is to bring them into the hospital. We have a secured space here where our infectious disease team are currently looking after them.
Now, a lot of people in China, where this all started, have been wearing masks, hoping not to get sick. But infectious disease doctors say there's not a lot of information to support that masks can really keep away the germs. The masks that doctors and nurses wear are medical grade and not the ones that we would buy at the store.